Hi, my name is Jesse Salo. I'm a certified community health worker with Texas Tech University Health Science Center, El Paso. I'm part of the Casa, a cervical cancer prevention program offering education and free screening to those eligible. Let's learn a little more about cervical cancer today.
Let's talk about what is a pap test. A pap is a test that finds abnormal cells in the cervix. It can find changes in the cervix before they turn into cancer. A pap test can also find cancer early when it can still be treated. The cervix is the lower part of the uterus connected to the inside of the vagina. Cancer can develop in this area, and this is known as a cervical cancer or cancer of the cervix. Now, we can talk about screening for cervical cancer that can prevent or catch it early. So the way screening is done, the doctor uses a plastic or metal instrument called a speculum. The speculum keeps the wall of the vagina separate so that the cervix can be seen. A small brush is used to get some of the cervical cells. When the doctor uses the brush, you may feel a little pinch. The cells are put on a glass slide or in a small tube. The same sample can be tested for HPV as well. Then they are sent to the lab to be analyzed. This will show if the cervical cells are normal or abnormal. The pap test only takes a few minutes. Some things to remember about a pap test are: you should have the pap test when you are not on your period. You should not have sex for 2 days before the test. About 2 days before the test, you should not use vaginal douches, foams, creams, gels, medicine for the vagina. If you use any of these products, they may hide abnormal cells. Now, we can talk about cervical cancer. Cervical cancer can take many years to develop. First, healthy cells begin to change and become abnormal. Over time, these abnormal cells can eventually become cancerous. For this reason, it is important for all women to have pap tests regularly. How common is cervical cancer? Well, every day in the US, 35 women are diagnosed with cervical cancer, and every day 12 women will die from it. Remember, a pap test can discover cancer early when it can be easily treated. The number of women surviving 5 years is much higher if found localized at 92% than if it is diagnosed late or in distant stage at 17%. A pap test can also identify changes in the cells before they turn into cancer. These cells can then be treated and cancer prevented. Now, we can talk about a known infection that has been linked to cervical cancer. HPV infection is very common in both men and women and is spread by sexual or intimate skin-to-skin contact. You are at greatest risk of HPV infection if you had sex at an early age, have had multiple sexual partners, or with someone who has had multiple sexual partners. Some types of HPV can cause cancer of the cervix, vagina, and vulva in women, along with cancer of the penis in men. In both men and women, the virus can cause cancer of the mouth, throat, and anus. The good news is that high-risk cancer-causing types of HPV can now be prevented with a vaccine. It is recommended in girls and boys aged 9 to 12. For adolescents and young adults who have not yet received a vaccination, it is recommended up to the age of 21 for men and to the age of 26 for women. Here are some of the factors that can put women at risk for developing cervical cancer. Age. In the US, most women diagnosed with cervical cancer are between the ages of 35 and 54. HPV. Infection with a high risk HPV types puts you at higher risk of developing cervical cancer. Sex. Early age sexual activity. Having multiple partners or being with a partner who had or has multiple partners. Smoking. If you are a smoker, your risk of cervical cancer doubles. Pregnancy. Women who have had more than 3 full-term pregnancies and women who become pregnant under age of 17 are at higher risk. Family history of the cervical cancer. Most women who get cervical cancer do not have family history of cancer. But if your mother or sister had cervical cancer, the probability of you developing can triple. Screening for cervical cancer is particularly important in this region because Hispanic women, women living in rural areas, and women living in the border have higher rates of this type of cancer. Here are the most recent guidelines for pap testing. Women aged 21 to 65 should have a pap test every 3 years. Women 30 to 65 have the option of getting tested every 5 years if they include HPV testing, which is done at the same time. Women who have had a hysterectomy should talk to their doctor about whether they need a pap test. To help prevent cervical cancer, you can limit your number of sexual partners, practice safe sex, eliminate smoking, and the most important thing you can do is to have a pap test regularly. From the Casa en Casa program, we would like to thank you for taking the time to learn more about cervical cancer. And remember, it is important to get a pap test to detect and prevent cervical cancer. HPV is a known infection that has been linked to cervical cancer. Be aware of what can put you at risk for developing cervical cancer. Thank you.